All right, folks, looks like 7:30 to me. So I would call to order this regular meeting of the City Council, City of Port Richey, held here at 7:30 this Tuesday, September 22nd, 2015, at City Hall in Council Chambers in Port Richey, Florida. We will stand, please, for the invocation and remain standing for the Pledge of Allegiance. Thank you. By Pastor Leonard Lord.
Evening, everyone. Father, we thank you. The word says, is the earth is yours, the fullness thereof, and the people in it. And we want to thank you that you give us Port Richey in this area to live in, where we can have sunshine on our shoulder and a gateway to the Gulf. And Lord, we thank you for these that are gathered tonight, Lord, and we all look to a greater wisdom than ourselves, that unified wisdom, and most of all, wisdom that comes from above. So, Father, tonight, as this agenda comes forth, Lord, we thank you for our acting mayor. Lord, we pray for the election coming up, that it would be just done so decently in order, and the people would come out to just support the city. Now, Father, we just ask you to help us do it with wisdom and peace, and just thank you for these your servants. Lord, protect them and their families, keep them healthy, particularly watch over, Lord God, our police department, our fire department, and those that are on call running toward the trouble. And we just thank you for them and ask you to watch over them in Jesus' name.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And we'll take, thank you, Pastor Lord. We'll take just a little second here and let Phyllis settle in. No problem, no problem. No problem at all.
Good evening, everyone.
It was on? They leave it on, yeah. New rules.
New rule,
New
yes.
rules. Okay, Madam City Clerk, roll call, please.
Yes, sir. Acting Mayor Bill Colombo.
Here.
Councilman Steve O'Neill.
Here.
Councilwoman Nancy Britton.
Here.
Councilman Terrence Rowe.
Here.
Interim Councilwoman Phyllis Gray.
Here.
City Attorney Joseph Public.
Here.
And City Manager Tom O'Neill.
Here. You got to lean into it.
All right.
You got to speak into it. Thank you very much. Okay, approval of council minutes, regular city council meeting minutes of September 8th, 2015. Do I have a motion to approve?
Motion to approve?
Do I have a second?
Second.
All right. Any comments, suggestions, adds, deletes? We all good? Okay, all in favor?
Aye.
Okay, up to announcements. We will go to our city manager, Mr. Tom O'Neill.
Yes, thank you. The first item I wanted to cover is to address a matter that was brought to our attention at the last council meeting by Mr. Daly. He is here tonight. We followed up on this at the staff level. I met with Mr. Daly. He also had a separate meeting with the building official. The building official has determined that it indeed was not a requirement to get a city permit for the boat ramp on Sunset in the Davis subdivision area. So indeed, we've determined that we do not have an issue with that. So all of those individuals are present tonight. If the council had any questions on that, it should feel free to ask. The city attorney hasn't had an opportunity yet to look into this for his independent review, but that will be forthcoming. Going on, I have a couple of comments I just wanted to share with the council. As you have seen, our street paving improvements are underway. The paving is complete in Nix Park. We finished the seal coating today. We've done a number of other maintenance items at the park, removed dead trees, did a general cleanup, stained the concrete, and marked off the parking spaces. We plan to have the park open by this weekend for use by the general public. The paving and base improvements have started on KFC Drive, and you will see those in pictures that I have sent to you to keep you updated. This Thursday at 10 a.m. we will also have a pre-construction meeting for the Harbor Isles water main improvements. I anticipate issuing a notice to proceed with the construction of that project at that meeting. They have met all of their insurance requirements with the city and provided the performance and payment bond. as we just mentioned just briefly ago, we're trying to improve the audio quality of the recorded council meetings, and the microphones that we have are good microphones, but they won't pick up more than about 5 to 6 inches away from them. So you're encouraged, if you can, to speak directly into the mic to assist in improving our audio quality of the recorded meetings. And lastly, we will meet again on October 14. The special election is on the 13th, and the charter calls for us to meet as a city council on the day following the special election.
Oh, kidding me.
So with that, I don't have anything else to add.
Mr. City Attorney?
Just to address that boat ramp issue, I have had an opportunity to look into it a little bit, and I've found nothing at this point that would warrant the city getting legally involved in this whatsoever. I still have a few things I want to look at, but I really don't anticipate anything changing my opinion at this point.
Okay.
That's all.
Anything else? That's good. All right. Comments from the general public. First signed up we have here is Mr. Thomas Brown.
Thomas Brown, 7436 Candlelight Court. Councilwoman Britton at a prior meeting said she was tired of hearing me ask the same question. Did the lake at the end of Candlelight Court exist prior to 1980? She stated that a decision has been made. I still do not have that decision. If Ms. Britton is referring to the city manager's statement that in his opinion the lake did not exist prior to 1980, that is not a decision, that is an opinion. My opinion, based on fact, is that the lake was there long before 1980. On Pasco County documents, there is a reference to Lake Cox prior to 1980, as you can see on the deed that I provided you. Michael Cox saw the lake where it is today in 1979. If all that matters in this city is the city manager's opinion, then I would like to receive it as a decision, not as a no legal status opinion. Councilman Steve O'Neill said if I didn't like the answer that I got, I should get a lawyer. What answer did I get? Is the city manager's opinion all that matters? Are city residents not allowed to have an opinion if it differs from that of the city manager? The city manager is basing his opinion on the words proposed lake from the preliminary, and I repeat, preliminary development plan. It is not a city document, a county document, or state document. It is only a preliminary development plan drawn by a surveyor for the property owner. Because I have not received satisfactory proof otherwise, I will ask again. Did the lake that is presently at the end of Candlelight Court exist prior to 1980? Thank you.
Thank you, Mr. Brown. Larry Daly?
My name is Larry Daly, 8150 Brent Street, Port Richey. I would like to thank everyone for last couple of weeks ago's presentation that y'all allowed me to go over the time.
Excuse me.
I'm sorry. Is that a little better? Okay. All right. I want to thank everybody that worked with me. Mr. O'Neill, I want to thank you for meeting with me and the issue. Mr. Osmo, I appreciate you meeting with me as well, trying to work on this issue. I still do think that there are some irregularities as they are stated in here, and I'd like to present the council with those irregularities, and maybe we can have further discussion on this. According to Mr. Cosmo's letter, all construction improvements, repairs, alterations, or demolition on or to real property that require a building permit under the Florida Building Code or the Land Development Code of Port Richey must have a notice of commencement. So, number one, I think that that's one of the facts that needs to be re-looked at. There is a statement below that, and I guess you guys all have this, that When the parcel ID was turned in on this piece of property, it was stated that because it had no mailing address, that it went to Mr. Priest. That's a false statement. It took me about 15 seconds to go on the property appraiser's website and find the address for Riverbank. Going on into his interpretation, he says a boat slip is like a residential driveway or a sidewalk. Without a structure or building placed on it, it doesn't require a building permit and is outside the regulatory framework of the Florida Building Code. It is my interpretation, and this is Mr. Cosmo's statement, that section 10-121B2 of the Port Richey Land Development Code applies to this. And he said, goes on further to say it doesn't mean that it doesn't have to comply with other codes, which is true. He makes a further statement that the paperwork on file has a few irregularities, but it should never have been permitted to begin with. Well, I guess my first question is, does Mr. Priest get his money back for his permit? And I've also checked around to see who other people have had boat ramps installed around here. And I believe, I'm not 100% certain, but I think for his boat ramp that he put in. So I'm a little bit skeptical of the fact that you don't need a permit to put in a boat ramp in the city of Port Richey. What that would mean is that if any of us decided that we wanted to pour 10,000 yards of concrete into the Cody River, the city's okay with it. That doesn't make a lot of sense. So I question that.
Thank you, Mr. Daly. Mr. Daly,
Okay.
thank you very much. Pastor Leonard Lord?
Thank you, Council. A few things. First of all, Saturday is our Cure Fest, and I just want to just ask Phyllis to forgive me for not getting the info by. I was by here and got here late. I've had it in my truck. But anyway, for Cure Fest, will we be meeting up at the Axe Resource Center? That will be 8:30 Saturday morning. And so there we'll have teams going out mostly from senior nutrition, but we're going to have some people doing some cleanup in the city. I talked to Pat. Council, Steve and Nancy have been gracious to come with us. Just want to let you know, if you get the word out, we'll probably try to get to the projects about 9 or 9:30, and then we head back to Eat at 1, where we'll have a barbecue. A church is taking care of that, and just be having a time of getting to know one another and the things that we did together. So number one is Cure Fest. That will be this Saturday, September 26th at 8:30. We'll meet at the Axe Center across from the Walmart in Hudson on US 19. Next is October 4 is the Liberty Tour. I had given you some things on it, and each of the council will find a DVD. There's a promotional that myself and some other pastors did, along with Ronald Reagan, Rabbi Kahn, and it'll really, I think, enlighten you. I just trust that you'll use those. If you don't want to look at it, you could give it back to me and I'll pass it on, but it's yours to have if you'd use. And I would like if you could take a few moments. The whole thing's not that long. The longest clip is 10 minutes. And so we do invite you to come out October 4. There will be at Bishop McLaughlin, and at Bishop McLaughlin we're going to have resources, everything from the pregnancy center to feeding programs to counseling to the prayer things. So what we're doing is networking Pasco communities that people can see and get resources, as well as hearing from people of what it's going to take to keep liberty in our nation. So it's Gimme Liberty Tour. You've got a card. The information's there. It's self-explanatory. Be great. Officers come in uniform. We'd like to have a presence there. Just appreciate it. The third thing, which is exciting, we were on a conference call from Houston today, and our Governor Scott has called for the state of Florida to have a day of fasting and prayers from the book of Joel, where the nation was in trouble. And it's really... His staff has been to some of them. This is about the 4th or 5th governor that's called it, and it will simply be a prayer. That will be October 24 over in Orlando Convention Center from 10:30 to 4. The governor will be there introducing it, and so we're calling people that love America and care for our future to come to the Liberty Tour. We'll also have more information about, it's called The Response, how do we as Americans respond to the time. So I want to thank you for your time, council, and just be honored if you'd look over this and be a part of it. Things are happening great on the front line, I think, to get our nation back to maybe the days I lived in when we didn't maybe lock our doors and we had to have police everywhere. But Lord bless you. Thank you for your time.
Thank you, sir. Dale Massett. To the city clerk, please. To Tammy. She'll hand them out.
Dale Massett, 8221 Hayward Lane, Port Richey, Florida. Could I pass these out?
Well, just hand them to Tammy. She'll pass them out right now.
Okay, Tammy. There's 4 different. I think I gave 10. I think the top sheet is the one that's mine. What is with the others? Got it. I'll start on this end, make it faster. There you go, Mr. O'Neill. On this phone.
Thank you, Dr. Dale.
You guys can keep these separated over here. Miss Governor Rose, how are you? Thank you. Oh, and I didn't keep, Tammy, can you keep me one of those?
Actually, sir, there's not even enough copies to go around. I apologize.
You have any left over?
No, sir.
I didn't print one for Mr. O'Neill because I think he knows.
Mr. Public's
Mr. Massad, the time is ticking away. Don't know.
What?
This is public comment. It's a 3-minute time period. It is written in code that way.
Okay.
It doesn't mean you come up here with a whole boatload of agendas. I'm sorry, that's not the way it's written.
Okay. Sandy has given me her 3 minutes.
You may do that.
Okay. I want to start with the attachment A. Mr. O'Neill has said the new ramp location, which I have asked every one of you, did you vote on the ramp? No. But it's been presented to the Restore Act. It'll improve recreational boating access, which is wrong. It causes a log jam in the water. It causes a log jam. You're dumping 68 boats, weekends every day, and during the weekday, I don't know how many, on Old Post Road. That's her neighborhood. I live there. Instead of doing something at Nick's Park. It's an absurd idea. The result, we closed 2 ramps and we opened 2 ramps and spent a lot of money. Not only that, Mr. O'Neill has gone over the $667,000 we got from the Restore Act, and he's gone to $1 million. So you guys get to make up the extra 400,000-ish. Just a comment real quick for this council. I had a lady from the south side that emailed me. They plant flowers, we ask for drainage. Okay, I didn't get my own stuff, so. Is there any extras? Terry, let me have yours, please. Those that stuff, yeah. I just all of them. That one. We did that one. Okay. Sorry this didn't turn out. Now, did this council vote to amend the FCT for Waterfront Park? Did anybody vote for that? Was this council ever voted to amend the agreement with Florida Control?
Well,
No, they don't have to. Okay.
it's really not a question.
You don't have to, okay. Now, Mr. O'Neill, in this document, states, our Restore Act funding for public improvement set for, in the Restore multi-year improvement will be reconsidered by Pasco County. Did you all allow that kind of statement? You could lose $667,000 because Mr. O'Neill decided he's gonna amend the FCT deed. And he's been told over and over again he cannot do that. Okay, ramp, Mr. Cosmo, real quick. We made an error, he says right there.
Tammy, he had another minute and a half left of his own time, so put that.
Okay, thank you. Thank you very much, Mayor. We made an error. The result of that error is Jim Priest owns a ramp. Mary Jo Haynes doesn't have anything, and he says we're not involved. I don't understand that at all, Mr. Public. Didn't do a very good job, guys, I'm sorry. And last thing, new lawsuit. Did Mr. O'Neill ever tell you all we have a new lawsuit against the city? Anybody knew that? Man's not doing a very good job, folks. Thank you.
Anybody else for public comment? All right, I'll bring it back up to council, and I will answer for myself, yes, or aware of the lawsuit from Mr. Palumbo. Actually, yes, we are aware of it. I'm aware of it. I think everybody else on council is, just to answer that quick question right there. Again, we bring it up to council at this point. Comments from the mayor, myself, and city council. So, except for that one little thing to throw in there, I'll start with you, Phyllis, since you're the new one here, and that's usually the way we go.
Oh, really? Thank you very much. I really don't have any comments except to thank those employees of the city who came to Sand Pebbles 9/11 Memorial. Both chiefs were there, and utilities, and Ms. Britton was there, and of course the city manager. It's a very beautiful event, and it's very meaningful every year. And I just wanted to personally thank those who came, and kind of disappointed to those who did not. I know we all have lives to live and jobs to go to, so just wanted you to know it will go on every year. You will be invited every year, and it will be even more and more meaningful, because as the years go by, there's always the chance that people will not remember. And we at Sand Pebble have chosen to impress upon everyone that this one event on 9/11/2001 forever changed our country. And so we have decided that we'll remember every year, and we hope that next year perhaps you'll be able to attend. Thank you very much.
Thank you. Terry, anything to open with? Nancy?
Please. Oh, I was just reading some things. I just wanted to kind of report on our little group that met, and just let you know that we're trying to work on setting up a GoFundMe page for the splash pad and do a press release. So we're kind of moving in the right direction, finally.
Great. Is that all?
The only other comment was, as far as the fencing issues and Candlelight, that decision was not Mr. O'Neill's, it was our city attorney's. That's all.
Okay. Mr. O'Neill?
Couple of things.
Couple things.
But first, the splash pad was mentioned, and I wondered if Nancy had read the recent article, I believe it was Hernando putting in a splash pad.
Yeah, everybody seems to be putting in one.
I didn't know if you'd seen the article, but, you know, that might be some good feedback for our, I know the group you're working with. Yeah, just a couple of things. First of all, it's nice to see the work on the KFC drive. I understand that work on the asphalt should be done this week.
Yes.
Security upgrades in the email. I don't know if you folks received anything that was a breach in your email. There is note that something came from Chrome onto Windows. I don't know if we can have IT check into that. I also mentioned in the last meeting that we were getting tons of junk email, and now we're getting even more. All of a sudden, the last maybe 6 months plus, we're getting a load of this type email. The paving and patchwork at Nix Park, I want to thank everybody that's involved, all the staff. Also, I drove past that area, the dead tree removal and the trimming work. Thank you, folks, very much. Public Works, everybody. I would like to see us, I know we have some short agendas. I know we have an election coming up. We got 2 candidates here. I don't know where the third one is. Continued discussions on revenue. These are important. You guys are familiar with it. If you're not, get familiar with it. There's a lot coming up. We've talked about some of these. Street lights, trash pickup, stormwater. Let's, again, get these on an agenda. Let's start talking about them. Some of these totaled quite a bit and can help us out. These are topics that I hope our candidates will talk about. I do appreciate information coming forward when we talk about redevelopment projects and we talk about something that's getting close. We're going to be turning into October here very shortly. Look, change is hard. It's never easy. There's a lot of discussions going on. I hope these funds will benefit Port Richey. I hope we just won't bow down and be the same old, because if that's what we want, I'm not sure why we're still a city then. Thank you.
Okay, I just like to add a couple other things. And obviously, we don't have our IT guy around, do we? Is he around? Is he listening to you? Just surreptitiously, or is he?
He's multitasking.
Multitasking. Now, I was just, when I used to run an Exchange server, we had a subscription to a junk email filter. Obviously, when you have an Exchange, an in-house Exchange server, ours might be in the cloud now, I don't know, but when you have your own Exchange server, your own domain name, plus you have up on the website for the city everybody's email address, unless you have a functioning spam filter, that's what you're going to get. You're going to get, hundreds of them. And I've had it happen in private companies. So I don't know who we use for our email filtering software, but it's usually one of the bigger companies like Symantec or somebody like that, or McAfee, that runs the, and they basically capture the mail coming in and filter it before it ever gets into our server. So, and of course there is the possibility of the server having gotten affected. I don't know, but I'm just saying those are a couple things we need to look at. But yeah, if we're still getting boatloads of junk mail coming in.
I don't know why, because I don't seem to be, well, maybe.
I don't either. I don't get them.
Maybe on the Exchange, if you actually go onto the website, I get mine right through my
Well,
phone.
I go onto the website, but I use Firefox. I don't use Chrome.
Okay, 'cause
so
I- 'cause
maybe
I
it's
go right
maybe
into-
it's the platform you go in on. I don't know.
Yeah, I go right in through my phone and
Right.
it,
Right.
I don't know
So
what it-
there again, I don't know. I don't know what the story is there. So that needs to be looked into. Mr. Pavlik gave his preliminary opinion on the issue of the boat ramp. I expect him to look into it some more,
Yes,
which
sir.
he is going to, and so will our city manager. If it wasn't mentioned, if I missed it, if I did, I'm sorry. The quick attention to that huge pile of junk that was dumped on Pier Avenue. It looked like somebody cleared out a house and put it on the side of the road, is basically what it looked like.
That's what happened.
And code
A
enforcement.
crack house.
I have no idea.
Well,
I
I'm just saying.
It looked to, if you were going to make me guess, my guess would be, I shouldn't guess. I'm a mayor.
Okay.
Guessing is really not my
Okay.
business, but.
Where was it?
Across from the hotel there.
Yeah.
you know, and you got a line of houses along there up here on the west side, so.
Here in Mallet, wasn't it Mallet? Was it Mallet?
It might have been
Yes, it
around, was
was.
it around Mallet? Yeah. it was
Here
around-
in Mallet.
Yeah, so that's right around where it was, so, I mean, somebody just, who knows, you know, somebody just cleaned their house out and piled it on the other side of the street. And it was just this mountain of debris out there. So, code enforcement got on it, y'all got a front loader out there, as I understand, and got it
Yes.
hauled away and plan on billing the owner for the work that was done, so I'm very pleased to have seen
Yes, sir.
that. And that happened quick, so that was good stuff too. As far as I know, there's been no change in the relationship with us and the state concerning Waterfront Park, as far as redoing a contract or anything like that, you know, the original agreement or any of that, so.
If we're not,
You know, really, I'm just, to answer your question, I'm just answering your question. I really don't have to do that, but you know that, but, you know, I'm just telling you that one bit. If you want some more of it, please call Mr. O'Neill and follow up with us with an email if you'd like, and that would be fine. I have no problem with that, so, okay? All right, that being comments from the mayor and city council, we get down to the agenda, and we get down to item number 1, which is the consent agenda. Do I have a motion to approve?
Motion to approve?
Do I have a second?
Second.
Okay, anybody have any issues or anything they want to discuss about it? We all good? Okay, all in favor?
Aye.
Aye, okay. Now, moving on. Council business, agenda item number 2 is the local mitigation strategy. Mr. O'Neill?
Yes, in your agenda tonight is the updated annual report on the local mitigation strategy. The report was prepared by Veronica Hanson, who has taken on this responsibility after the retirement of Donna Rose last year. She also, as a matter of interest, is underway with exam preparations to be a certified floodplain manager. This is the result of the committee that meets several times every year to discuss all of the focal points of the city's plan. And it has to do with our community rating system, which determines the discount that the city of Port Richey residents receive with regard to flood insurance. We adopted a resolution on this plan in 2003 to become a member of Pasco County's plan, very similar to every other city in Pasco County. And this is your annual report. This has been on the agenda every year. We're requesting that you consider this for approval tonight.
Okay, any comments from council on the local mitigation strategy as presented to us here?
I have a question.
Sure.
Bill. Mr. O'Neill, page 3, where it talks about the different departments, and it very briefly mentions the fire department responsible for coordinating and managing all activities related to and surrounding an emergency event, but then there's an awful lot that talks about the police department. And isn't it also that part of the fire department that does the immediate response to a situation? I mean, shouldn't something more than one little line identify what the fire department does?
We certainly can expand on that. This language has been in the annual report on a yearly basis. The fire department implements the incident command system requirements, and generally the fire chief would be the incident commander during a disaster or other public emergency. Chief, do you have any further comments on that?
No, but back in when they first started this.
Well,
they
yeah,
wanted-
was it yes or no?
Pardon me? Yes. When they first started this, they wanted a short, concise answer. They wanted to keep this documented as short as they could keep it. So that's the reason everything was just basic, and we laid it out that we respond to everything, and that's pretty much the end of it.
Okay.
Well, I would, if I might interrupt.
Yes, no.
Yeah, that sentence is essentially all encompassing. I mean, that sentence right in itself is probably the most powerful sentence in the whole document, which basically says the fire department is responsible for coordinating and managing all activities related to and surrounding an emergency event, which is essentially what the chief was saying. So even though it is a short sentence, it's as broad as can be. It is, yes, it is your responsibility. Yeah, any kind of disaster there may be that, you know, is a threat to life and limb and property. You're the one that's in charge of coordinating and managing all activities, so
Okay. That's fine, I accept that. Thank you.
that's my interpretation.
Motion to approve.
Second, okay.
Second.
We've already had discussion. Any discussion from the public on this? It's a pretty standard affair, but it's a pretty important document too, so, you know, we do take it seriously, so. Okay, all those in favor? Aye. I believe it's unanimous, so. We will move on to our next agenda item, which is the employee health insurance, which is supposed to be under 3, but under 3 is legislative delegation in my book, so it might be misnumbered here. Employee health insurance in my agenda book is page 18 of 39, as far as the agenda goes.
Separate.
Well, yeah, but there's memos there and stuff. It's separate from that, so. So maybe it was just in my book it got misplaced. Somebody messing with me, I don't know. Is everybody on it? Okay. Mr. O'Neill?
Yes, it is that time of year again when we consider the health insurance proposals that have been solicited by the Gehring Group. The Gehring Group offers its services to the city under a mutually executed contract that was entered into in January of 2010. They solicit proposals. They get submitted to you for your consideration and action. I've given you some extra information this year. I want you to please draw your attention to the second paragraph where we note that the benefit levels do vary by provider, the employee group, and the claims experience. We've had a changing experience over the last several years, and the City of Port Richey's claims experience has improved. The proposals that we have were solicited among all known carriers. We received 4 proposals, including Florida Blue. The proposal that is the least expensive was submitted by Humana, but I want to draw your attention to the sheet where their various benefits are explained, and there are some benefits levels that were lowered in that proposal. I also asked Aaron Applegate to do a survey of the other cities nearby, and you'll note that in that survey, the City of Port Richey's health insurance cost per employee happens to be the lowest at this time, and considerably lower than next door to Port Richey. And what's on the agenda, every plan and proposal that is submitted has been covered with regard to an allocation that's in the budget. Mr. Sean Fleming is here tonight from the Gehring Group to answer any questions that are posed by council, and you should feel free to ask any questions. I like the idea of staying with Florida Blue at the consistent benefit level that is now provided to the employees. However, that is not the cheapest alternative. So Mr. Fleming is here. He can feel free to approach the podium. We've got another meeting if you decide you need some more time on this, but the sooner the better, provided whatever decision it is that you make. We may need to hold an open enrollment.
Would you like to make any comments, sir?
Good evening. Well, Sean Fleming, Senior Benefits Consultant with the Garin Group. First off, I'd like to say that I think the city manager covered a majority of it, so would be happy to answer any questions that you all have. But just to second a couple of things that he said, we did go out to RFP, you received, there's really only 5 carriers left in the market. You received proposal responses from 4 of the 5. The one that you did not receive a response from was Aetna, which if you go back and look at history over the past, let's say 6 years, I think you've intermittently been insured with them about 3 separate times. So sometimes as you start to change carriers too many times, they start to look at that RFP and decide whether or not they want to respond. It's very expensive for a carrier to write new business, so when you change carriers a lot, sometimes they shy away. Other than that, would like to open it to questions, but one thing I would just say, as we look into the future of healthcare, starting in 2016, one thing that is going to affect the city is your first renewal in 2016. All groups with less than 100 employees are going to be treated as small group employers. What that means is you're going to be rated solely based on community ratings. The insurance companies don't have the ability to adjust your premiums to try and win business. It's going to be the rates that they file with the state for that plan based on your demographics. So we do have some change coming up next year. It doesn't create much of an issue this year. One benefit of that is if you were to stay with Florida Blue, they're able to grandfather you and treat you like a large group. So that means that as we go into next year's renewal, they would have more flexibility on how they price your renewal, how they can make a business decision to try and get rates to a certain area. So that's just one item to keep into consideration for next year, and that's because you had them going into last year, that they have that ability to do that next year. So it's just one consideration as we look into that. So those were my initial comments.
Okay, well, I'll bring it up to council for discussion.
I just have a quick question. You talk about Aetna not being part of the bidding process. Aetna just recently purchased Humana. How is that affecting the bidding process?
So right now, what the general outlook, there were 2 actual, Aetna purchased Humana, and then Cigna is merging with Anthem. Anthem does not operate Blue Cross Blue Shield in Florida. They operate it in 13 other states. So there's not a huge effect from that merger in the state of Florida. With regards to both of those mergers, though, what we're hearing is 2016 is probably mid-year, the earliest that we would know, even if the government approves those. There's some concerns from an antitrust point of view. So right now, all of those carriers are operating business as usual until they know 100% that the government is, if the government will approve that.
Interesting. Mr. Rowe?
Very true.
I'll wait for right now.
Okay. Councilwoman Gray.
Thank you. Mr. Fleming, a question. I'm not good with insurance. I'm really not. Guess I don't really like insurance, but it's a necessary evil. Looking at the different plans, which plan gives the most to the employee without any significant change?
Well, the plan with Florida Blue that we're looking at, the renewal, is no cost increase to the city. It's actually a slight decrease, and it is no change to the level of benefits for the employees.
Okay.
The option with Humana has some benefit changes, some for the positive, some for the negative, so it's a little bit of a wash depending on, where you were to incur costs throughout the year. So it could be more beneficial for somebody that just goes to the doctor, could be less beneficial for somebody that has a certain medication. And then the biggest thing with Humana is there's just disruption anytime you change. So what I mean by that is, right now, if somebody's using Florida Blue, their doctors are in network, and for the most part, other than a doctor making an individual decision to maybe drop out of the network, that network will stay the same as we go into next year. With Humana, you start over again. So you could have to find all new doctors. If you already have authorizations on file for certain prescriptions, you may have to start that process over. So although there's some benefits that could be better for you, there is that effective disruption, which obviously will be a little bit different for each employee. Some it won't affect, and some it could drastically affect.
Right. And another question. If an employee travels out of state, are they covered without a problem?
So that's a little bit of a loaded question.
Yeah,
So
meant to be.
let me try and give you a multifaceted answer there. In an emergency situation, you are always covered. And if you go out of state and you go on vacation, you're always covered in an emergency situation as you were in the state. Obviously, we don't pick where we typically go for care in an emergency. We go to the closest place possible. So in an emergency situation, you are always covered. Florida Blue, even though they're an independent Blue Cross Blue Shield organization, there are other Blue Cross organizations all throughout the country. So there are some different partnership agreements where in a situation of needing specialty care, things along those lines, you can coordinate care with Florida Blue outside of the state. So it's a little bit of a gray answer. It kind of depends on the situation. For the most part, the guidance is if there's something you are actively planning, a surgery, something along those lines, you would want to stay in Florida other than some very rare
Right.
circumstances.
So for continuity for the employee, to stay with Florida Blue, there's no disruption as far as their doctors or anything else?
Yes, ma'am. That's
Okay.
correct.
Okay. Mr. O'Neill?
Yes. All right, you mentioned with, obviously, the advantages with the Florida Blue, but you spoke there at the end about what might be considered long-term, and with that long-term might be some associated decreases. As it stands now, we're just receiving a 0.08% decrease, basically nothing. Everything stays the same, the benefits stay the same, which is a good thing. But I'm more curious, and I don't know if you can give any figures, but from what you noted, obviously a long-term relationship. I say long-term because I don't know how long we've been with the Florida Blue, but
You're still in your first year with Florida Blue.
as you indicated, there may be some association, and with that association be some decreases. In other words, we can come back next year and see the same 0.08, and yet with the Humana, we're seeing a 12% reduction. Now, I don't know how that would compare to the average employee in those differences. I think there's a benefit with staying the same, and while I know that it isn't going to save us money, I've got some other things pointed out here that I know will, and I'm surprised we're not talking about them, because the larger companies, like the company I work for, we are talking about them. So I'll talk about those in just a couple of minutes. But as you indicated with, obviously some decreases may, perhaps with long-term, I don't know. We'll see, I guess. What we're not talking about are some of these health risk assessments and participation in wellness activities. I didn't hear it mentioned last time. I'm not hearing it mentioned this time. I'm a little surprised because it's happening all country. I myself am part of a plan where I get my blood drawn. Those results are obviously forwarded, and we're engaged in, I think it's a particular name program. Name it. I believe I have the exact name here. I was trying to recall it. I'm just our work is relatively new to this, but the savings were about $40 a month per employee. That associates to several $100s per year. It is an engaged process. Obviously, the employee has to do certain things to be part of that. I think it's a good thing. I'd be surprised if we didn't have many people in our company working towards that. I think it should be mandatory myself. But anyway, if we look as a whole, salary and wages, which used to make up almost 70%, now make up 64%, because the other percent is spent on the employee's health care. And I'm not making these numbers up. These came from the Labor Department. I looked them up before I came to this meeting. So that's a little disturbing that trend is more healthcare expenditure, where I think some of these other risk assessments and participation in programs can certainly help. I realize we're a small city. That's why I wondered whether or not even the League of Cities would be part of something that would be involved in a wellness activity. So the discussion I think we should be having is not to look at the little bit of differences, although nobody was happy with the $10,000 deductible we talked about, I believe, last time. I think the plan has a lot of positives, but to look at how we can actually cut cost without reducing benefits is where we ought to focus. And those things aren't discussed. I'm really not interested in going through this and going through the little bit of numbers change and all that stuff. It's not going to do anything, folks. It's just not. Didn't before, it won't do it now. But if you look at cutting costs without reducing benefits, that should be what we're discussing. We're not the experts, but he is. So that's
You're
maybe
you're
what-
talking
can I
about a
address one of
wellness
your-
program, is basically what you're talking about. Is there any opportunity for the city of Port Richey
Sure.
and its residents to enter into a wellness program where they can personally save dollars on their,
So let me answer that, and here, it's not gonna be a popular answer, but it is what it is. And I'll tell you that we work with close to 100 entities around the state. A lot of them, we have very detailed wellness programs, doing health risk assessments, blood draws, all these things, premium credits, premium subsidies. Here is the problem you face as someone with less than 100 employees with the change that the government has made with the Affordable Care Act. Starting next year, your rates are gonna be based completely on community rating. So let's take it outside of health insurance for a minute and think about car insurance to talk about the concept a little bit. So let's say that car insurance was community rated. That would mean everybody would get the same rate, and you could go out and have 27 fender benders during the year. And Mr. Rowe could go out and have none, and you all would have the exact same rate. So that's what we're talking about with community rating with health insurance for groups under 100 employees. So we can come to you with all kinds of proposals to invest money in plans to reduce risk, to do all of those things. And with the way the law is written for 2016, you are not going to get any premium credit for them. And those programs bring a cost associated with them. And wellness is something that we love to talk about, we love to do. But the reality is less than 100 employers starting in 2016, no matter how much you do, no matter how healthy you are as a group or how sick you are, your rates will not vary. So, giving people $500 a month or a year in a health reimbursement account because they did a wellness program, now what we've done is we've added $500 an employee a year to your budget, and we haven't been able to get you any premium discount for that. So with groups that are in that situation where it's based on community ratings, we can do things like we could give a subsidy if you're not a smoker, and we could give you a premium credit. And those are all things that a lot of our employers we work with are doing. Unfortunately, the ones that are community rated, which has historically been 50 and under, but now it's going to be 100 and under, it doesn't have that positive effect on your premiums. So as much as we love to talk about that and we love to do that, I also want to give you a fiscally responsible option and not, tell you that if you do a walking program and you do all these programs, that next year you're not going to get an increase when your neighbor down the street that didn't do any of those things, you guys are going to get the same increase now. So I just want to make sure that as we present options to the city, that they're fiscally responsible in that matter and not leading you down a road of a false expectation of getting a discount on your insurance in the future years. And that, unfortunately, it's one of the hardest parts of being in a community rated system.
well,
So-
I would say that, in the state of Florida, we're in pretty bad shape because we have a lot of, older population. So if that's the community, so my children and, where in the past, the younger folks would pay a little bit less, older people would pay a little bit more. and this is kind of where the Affordable Care Act has kind of been going for a while. But that's really going to hurt, you know, some of the younger kids trying to get started with school loans and whatnot. And yeah, it doesn't give any incentive to do anything. We may as well just start smoking and drinking, I guess. I don't know.
No, I would disagree. I think, obviously, as you mentioned, it is sad because the power of numbers should be different. We should be talking about the power of numbers in not just a city of one, but 435 cities in the state of Florida. That's what we should be talking about. What we should be talking about is asking, why is a person who, for no other reason, just in trying to take care of themselves, look, we all have genes, we all have things that are going to come up in our life, but obviously with the Apple Watch, with the Fitbit, with all of these ploys, your argument won't keep going that way. It will change. It will have to change because although we can say there's a lot of negatives with the Affordable Care Act, there's some positives too. And obviously one positive, I think, is being able to help an employee who wants to be healthier have the tools to do so, and obviously not see any difference in their rates. Gosh, I just don't think that would make much sense. I think that there, obviously, as you mentioned, the negative is we don't have the numbers here. We're going to pay the same. But, it seems that we're darn if we do, darn if we don't, and having almost a helpless situation that we can't even engage in some particular health risk assessments or participation in wellness activities. And we're going to tell the employee, even if you do that and you're trying to help yourself, you're not going to save any dollars. Doesn't that sound wrong? It sure does to me, and I work in healthcare.
He doesn't make the rules. Question, the corporations, just I'm kind of picking your knowledge a little bit here. For instance, I own a large corporation. I'm based out of Atlanta, Georgia. And my employees are across the whole Eastern Seaboard. And are my employees being charged where my base is or in the state that they live in?
So the answer is it depends on how many employees you have.
Of
but
over 100.
Over 100. So once you go over 100, your rating is largely driven by your claims experience.
Okay.
So the difference between that and community rating is the insurance company is going to look and use round numbers. They're going to say, we collected $1 million in premium and we paid out $600,000 in claims. So that company in that year, if it wasn't self-funded, they made $400,000 in profit. The argument in that scenario is you're going to go back and say, hey, my group here needs a 35% reduction. And so that is, it's all going to be, once you get over 100, it's all going to be driven based on your actual experience. The reason it's not when you have under 100 employees is, I'll give you an example. I have an employer right now that has 2 children on $600,000 of medication each a year. So that's $1.2 million. If those 2 children were, if those 2 people were here on your plan, that would be, more than 3 to 4 times the cost of your entire premium. So there is a benefit to community rating in that if you have that happen, you're not going to get hit with a, I don't even know how many 1,000% increase that would be. You're probably still going to get an 8 to 10% increase under community rating. So there's a lot of situations where that works to your advantage, but in the situations you're saying, and I completely agree because I'm probably one of the biggest proponents of wellness programs out there. I've got my Fitbit on right now, and I am not saying that I don't advocate all those things 100%. I mean, I think there should be smoker surcharges and all of those items. But at the end of the day, when we make a recommendation to the city, to tell you to spend $50,000 in a wellness program or wellness incentives, I have to disclose to you that it's not going to have any effect on your premiums in the future years. So it's a hard position for me to advocate you spending that money when you say, what's my return on investment going to be on it? I mean, your return on investment is intangible, that hopefully you're helping your employees and their dependents get healthier. But unfortunately, with the way the government set it up, you're not gonna be in a situation of getting a premium discount for that in future renewals. And that's extremely frustrating to me, because that's the biggest thing we always wanna promote, but.
And we
it's
had
the
a
it's the
period where
hand
there
we're
was a
dealt.
lot of claims, I think, and as you mentioned, now to go with this community-based, and I realize, you know, look, I'm just making the argument that part is frustrating with having folks be involved in some of the risk assessment and wellness activities, but, you know, the rates based on community rating, I know we have to deal with what we have, and although there is another choice to save money, obviously, I myself am seeing the Florida Blue advantages, and it seems like that's what you would promote. I would agree that maybe is still a best fit for the employees that we have. And I know we don't have Pam here, we obviously have Erin, and I know she's new, but I know this was near and dear to Pam, was the, this benefit. And, you know, a lot of work was done on that, you worked with her, and this was a real passion of hers. So it's important to the employees, it's important to us that these folks are served and getting what they need.
Mr.
Yes,
City
sir.
Manager, did you have something you want to add? No, I thought, the way you leaned forward, I thought you had something there. Well, I want to go around and make
Oh,
sure I
sure.
got everybody first. Terry?
Well, I've got a couple of questions. So Blue Cross, Florida Blue is going to be the only one that'll grandfather at this point?
In the sense, their filing with the state allows them to keep you on a large group platform because you went on it last year. So if you stay on that, that allows you to stay on a large group platform. So they have the flexibility to not rate you on your current plan in that scenario.
Okay. On the spreadsheet here, under high-cost drugs, specialty drugs, I'm seeing an N/A. Is that not available or non-applicable?
No, sir. So on the Florida Blue plan, your specialty drugs could fall into a couple of different categories. Under the pharmacy plan, if it is something that is able to be filled at the pharmacy, so you can go get it at Walgreens, it's probably gonna be at the $80 copay. So there's not an additional cost share on it. However, with Florida Blue, if it's administered in a physician setting, so that could be an outpatient or inpatient hospital, or it could be a doctor's office, it's gonna fall under deductible and coinsurance. So under the Humana plan, depending on where you were to fill it, it would only be 25 or 35% coinsurance. So that would be a discount. Most scenarios, specialty drugs are administered by physicians, so that would be a discount in that scenario. For a few that could be self-administered, it could be a negative, but what we're seeing is about 90% of these really high-cost specialty drugs are being administered either by a nurse or a physician or in a facility.
Okay. What date do we have to act by?
November.
Expires at the end,
November.
so our new policy would go into effect November 1.
Okay.
Keeping in mind, though, that there'd be a lot of ramping up activity to be done if we chose other than our existing
That's correct.
plan. So it's not like we could make that decision October 31st.
Well,
So
let me pose that to Sean. Could we do this at October 14?
You could do it October 14th. If you were to do it October 14th, individuals would have coverage, but their coverage would probably not truly be active in the sense that, so if I went into the hospital on November 1st, I might not show up in the Florida Blue system, or in whoever's system yet. It doesn't mean that I wouldn't be covered, because we're gonna have the coverage, but I probably wouldn't be in the computer systems, have an ID card, be able to fill a drug without an issue. I would say until probably November 7th, somewhere around there, if you waited till the 14th by the time the process goes. It doesn't mean that people wouldn't have the coverage. There would just be some roadblocks, and we'd probably be helping out, making some phone calls to pharmacies, doctors' offices to help coordinate care for people.
There's also issues as far as people who are already being treated for something under one plan. When you change to another plan, that one has to phase out the covered injury, and you gotta phase in the new plan too.
Correct, so transition of care, somebody's receiving cancer treatments as an example, we can typically, like if a doctor fell out, we can get a transition period for a month or two where they can switch out and find new doctors, but obviously the less time you do that with, the more potential issues you run into.
You know, I have to say, Blue Cross has always been great to me. We have that through my employer. I've had that through most of my employers as the years have gone by. They're a huge commercial insurance employee division. They always deliver, and I think that's one thing that we need to look at for the employees, because, look, when you're sick, you want your bills paid. You want to know that you can go to the doctor that you trust. Those are important things, and for a lousy $2,000 or whatever, you know, give or take, either way, you know, I think that I really feel confident in Blue Cross and Blue Shield as a company for our employees. So with that, I would be inclined to go forward with this, because I haven't heard from any of the employees that they have any issues with the insurance that they currently have. And I know last year when we were choosing, this was really their preferred company. So I would be inclined to go with the negotiated renewal.
Well, for a motion.
Can I just, please, Mr. Rowe, were you completed with your comments?
I would like to bring the Humana to the attention of council, because there's a couple of things that are increases here, but I have to look at all the decreases. And there's decreases to the expense that our staff has to endure. As I'm looking across here, I'm seeing quite a few things that are cheaper. Of course, you don't get the alcohol and substance abuse. Now, I don't know how big a problem the city has with that. But if we're not having a problem with it, I don't see that, you know, that's a problem. The other thing is the imaging, and that is everywhere you go. It's $250 where I'm at. Here it's $300, so it's $50 more. $100 more than you would on the Florida Blue. But the bottom line here is what I'm getting to, is that your prescription drugs are cheaper, brand formulas, non-formula drugs. But the bottom line here, and Mr. O'Neill, you made mention of this earlier, we have to start looking at finances. And when I look at the bottom line here, there's $32,000 of saving here. I want to give the staff the best insurance we can. But if we have to start cutting staff to pay the bills, what favors have we done them? So I think we should take a hard look at that one as well. Florida Blue I have not had too much trouble with, but I am in a problem with them now. And it has nothing to do with this, but it just goes to show that there's problems in every insurance company. And I've had Humana in the past, and I've had Cigna, and I've had Florida Blue. So there's another question I brought up about, and I know the lawyer can answer this, as to if we were to go shopping. I understand Gehring Group is our provider of choice. Can you enlighten us on, if we wanted to go shopping, where our contract is and what our responsibilities are to Gehring Group?
I have not reviewed the contract that we have with Gehring Group. I'm not even certain what the terms and conditions are of that agreement, so unfortunately I can't comment on that.
I'm sorry.
Phyllis, please.
You know, I told you I don't like insurance, and I sure don't.
Some nights I don't either, if it makes you feel any better.
I noticed with the other cities, they switched to United Healthcare. I have no idea why. I personally have Humana. I'm pretty much stuck with Humana. I don't think I like Humana. because it doesn't allow you to go to your doctors of choice. You have to stay within this network. And that's the bad thing I personally don't like Humana for. And there are doctors that are leaving Humana because evidently Humana is not paying what the doctors want, plain and simple. That's what it is. There's a couple of questions, and I don't think it really is for Mr. Fleming. Is this the first time that this issue is coming before council?
For this year.
For this year?
For this year, yes.
Okay. May I suggest that next year, is this a yearly contract?
Yes, it is.
May I suggest that next year you visit this perhaps in August or an earlier date than a couple of weeks before the expiration of the policy?
We would love to get it to you as soon as we possibly could, and we actually did that. The Garing Group is limited by the quotation process. The providers will not give us or give the Garing Group a quotation for the policy until, what is it, Sean?
It varies by carrier, but 60 days, and I think next year as we go into the community rating, unfortunately, that's gonna be tougher. Small group, we don't know the government, there's some things in comment period, but small group, just so you know, right now in the state of Florida is 45 days, no earlier. Renewal comes out 45 days ahead. So because you're in more of that large group platform, we're able to push that out a little bit, but again, you're just barely over that cusp. So we get it as early as we can to city staff. I don't know 100% yet if that will be better or worse next year. My inclination is to think that we'll actually be under a tighter timeline next year.
But as soon as you get the quotations, you immediately prepare what you do for the city and get it to the city?
Yes, ma'am, and we go through a number of options. We try and pare that back. We start with sometimes 20 some odd different plans, and we try and pare that back really to a most competitive basis so we can identify who the most competitive carrier is, and then try and not give you a Chinese menu of 400 different options for the
Just to give you an idea, in early September is when Mr. Fleming first got his information back from all of the providers, and he requested a meeting with us. We went over everything, and then he went from that meeting to negotiate with Florida Blue and was successful in negotiating it downward to an actual decrease from the costs that we have now. That's a pretty rare thing where we can keep a carrier and we actually are going to have a premium reduction. So that's why we liked the idea of staying with the carrier. We want to get it in front of the council as soon as we could, but he was in the process, Mr. Fleming was in the process of negotiating with Florida Blue, because I think the first quote was a 12.8% increase, and he was successful at negotiating that down to a 0.8% decrease, contingent upon Florida Blue providing the dental, life, and disability.
Right. You know, it's almost like we have to stay with Florida Blue. And as I said, I don't like change. I really don't. And I don't want the employees to be negatively impacted, because just like whoever was it, Nancy, or said, supposing the employee needs care, and the worst thing, if you need your coverage, to have to be in a hospital and say, oh my goodness, I wonder if this is going to be covered. It's almost, you don't want to do that to an employee. So I think my opinion, we ought to stay with Florida Blue, because it does not give any anxieties to the employees, and that's the most important thing to me.
Well,
Go ahead.
I'd like to fit in here somewhere if I could.
Oh.
I just have a really quick statement.
We're just beating this horse up. I think
Nancy,
we
go
got
ahead.
to a
My
point
quick
here.
statement is, this is what I know about Humana and Florida Blue, okay? Florida Blue is good for all around. If you have to go to the doctor's office, you have to go to the hospital. You end up in a nursing home. You end up, well, I can't really say
No, you
nursing
can't
home
really
because
say
that's a
nursing
whole
home.
different
Yeah.
thing. But I mean, the bottom line is if you end up in a hospital, you could count on a lot of your bills being paid and so on and so forth. Humana doesn't offer those types of bennies. They just don't, and that's why they are cheaper, because you're getting a lesser product. Now, you're gonna see in some areas, yes, you're gonna get this, they're gonna give and take, and whatnot, but when you get into a serious situation, that's when an employee's gonna pay.
Steve, you had something else to add?
Yes,
Quick, though.
Slip.
I'll try.
It's
Look,
not
I
very
think the
encouraging.
staff has spent some time with this already. In the past, we went to Pam, and, she basically told us how it was. So here's how it is, folks. It's on page 2. Okay, in summary, I like the idea of staying with our current carrier, Florida Blue, with the benefit levels remaining consistent. Humana, although less expensive per employee, decreases the benefits per employee as depicted in the red on the attached sheets. However, the quotation submitted by Florida Blue is contingent on them being the provider for the dental, life, and disability with marginal increases. So that, to me, has to be answered, and once it is, we can get a motion together and end this. I don't think we want to delay this. I think he's done a wonderful job to tell us why this needs to be done tonight. So, Mayor, that comment alone, I think it's the most important part of what we're trying to do here, is that the quotation submitted by Florida Blue is contingent on being the provider for dental life. Maybe this gentleman
I
would
would
comment on
ask
that.
for clarification from either the
Right.
city manager or.
Sure.
Then we
and-
can make I can make a decision then.
And actually, all of those items, just to give you an idea, the city manager and I just kind of recalculated right before, and all of the other items with Florida Blue. So there is, on the life insurance, there is a $108 a year increase to go with Florida Blue for the life insurance. However, and maybe somebody can keep a rough running total, it's gonna come out very negligible. There's a $270 decrease on dental, and there is I'll give you the life, next is going to be the short-term disability. There's about a $108 decrease there. So overall, all those ancillary lines of coverage come out to essentially a slight decrease, basically a wash of a zero, no added cost, a little bit on the
Okay.
life insurance and the rest are.
I think that's very important. I
Okay.
think that's at the heart of our argument, so.
Well, let me get in a comment, get my own comment in here
Oh,
sideways.
Yes,
go
sir.
right ahead, sir.
Could I please?
By all means.
Thank you very much. Not a lot. I don't have a lot to say, because if you all have covered a lot of my points. Again, this is sort of a transitional year. So next year is going to be way different than what we're doing this year. Florida Blue is currently who we're with, and the staff is comfortable with that. It is not a price increase. I'm never comfortable with changing providers because it is very difficult on the staff to change providers. It just is. I've not heard any complaints about Florida Blue, so I'm in favor personally of Florida Blue, of the negotiated renewal.
I would like to make a motion
All righty,
that we stay with Florida Blue.
with the a motion to use the negotiated renewal.
Yes.
Correct.
Thank you.
Thank you.
With the benefits remaining
Right.
Yes,
consistent.
as
Exactly.
outlined.
as-
I will second.
We will second
Yes.
that. So I have a first and a second. I will go out for public comment on this one. Mr. Breedlove.
Thank you. Bob Breedlove, 5143 Limestone. I don't know why you're dancing around Cigna. The open access plan offered by Cigna is pretty competitive. Doctors are pretty well across the board between Blue Cross Blue Shield and Cigna. There are a few minor differences between the two, but you will find that with any difference in carrier. Importantly, you get a decrease, so do your retirees. If you looked at the retirees plan and the Blue Cross negotiated renewal, they're getting hit with 11.5% increase. If you only got 2 retirees, but still, that's a pretty negative message. The other thing is, by staying with Florida Blue's negotiated renewal, you're locking yourselves into only Florida Blue, the ancillary lines. If you go with Cigna, or look at Cigna, you have other ancillary lines to consider, and they can be competitive. I don't believe you have to put the entire city in the same ancillary line. If you go under Cigna, under Florida Blue, you're agreeing to do so. So you lock yourselves into a very narrow set of variances. I would urge you to reconsider. The biggest thing I want to point out is that there is a significant savings going to Cigna without a significant decrease or any decrease in service. I think if you look into that, you will find that to be true.
Thank you. Sir?
Sorry, I just want to provide one point of clarification on the comments that were made. Cigna is an excellent company, one that we work with quite a bit. If you look at page 3, there's a couple things. One, you'll notice on the bottom, under the Cigna proposal, it says requires completion of individual medical questionnaires. There's some additional caveats on that on page 5. Also that there's a couple fees for the Affordable Care Act that would have to be paid separately from that premium. So the Cigna proposal, the rates are not firm. They would require every employee and their dependent to complete an individual medical questionnaire. So the rates that you have from Cigna are the best case scenario, meaning they like the responses that everybody gives. Those rates could increase essentially anywhere from there to infinity, all the way to the point of Cigna just walking away and saying we're declining to write your business. So I just want to make sure that you're aware of that
Good
caveat.
point.
And I have seen groups do that and get no rate increase at all. And I have seen groups, somebody had a condition that was very expensive, and I've seen them decline it. So that's a gamut that takes a lot of time to complete. And at the end of the day, you may end up walking away from that, or they may walk away from that.
Yeah, good point.
Okay, thank you. Ms. Spalding?
Sandra Spalding, 82070 Post Road. I have Florida Blue, and this past year I've been in and out of the hospital quite a bit, as you all know. And I see many doctors right now. I have no complaints with it. I'm just going to leave you with that.
Thank you. All right, well, I'll bring it back up. Oh, I'm sorry, there's a hand that I didn't see peeking around the back of Bob.
Claudia Smith, 7335 Candlelight Court.
Ms. Smith?
You talked about a wellness program, and I worked for a large company that had a wellness program. There were a lot of people that didn't like it because they felt like Big Brother was watching. There were a lot of people that really liked it. What you might think about is if you end up going to Blue Cross Blue Shield and you do have a savings, maybe you could reward your employees for those people every 6 months if they have an improvement in their weight, their health, their blood work. The only problem is you have HIPAA that you have to worry about. But that would be an incentive that you as the city could do with that savings. Thank you.
Very good. Anybody else? All right, I come back to council. We have a motion and a second on a negotiated renewal from Florida Blue. All those in favor?
Aye.
Against?
Nay.
Motion passes. It is the negotiated renewal plan for Florida Blue.
Yes, negotiated.
Next item on the agenda, I believe, legislative delegation meeting, item number 4. Mr. O'Neill?
Yes, thank you. As you'll see in the packet, there is a notification that the Pasco County Legislative Delegation meeting will occur on September 29 at Sun Lake High School from 1 to 4. The public is invited. Assistant City Manager Jocelyn Martinez and I attended last year, and I spoke to the delegation regarding stormwater management and stormwater treatment and the issues that I believe are of regional importance. This particular year, our need to speak to them, I believe, is underscored by the flooding events that occurred regionally, and I believe that the state needs to help local areas more than it does at the present time. Additionally, I still believe in stormwater treatment, which is, in many respects, as I indicated in my memo, more polluted than raw sewage. The reason for listing it on the agenda is to see if there's any items that you specifically want us to cover, or if you wanted to attend yourself. Any council member can go and speak directly to the legislative delegation. If there are items that you believe we should cover in our presentation to them, then let me know, and we'll do whatever the council wants to have done.
Okay. Steve?
Yeah, I would stay with the theme that's outlined here already. In addition to that, I just wanted to ask, I know we've made reference to this before with street sweeper, you know, with all contaminants and so forth. You'd made some comments on that. I don't know where that would fit in here, but just thought I would ask.
Okay.
But again, I'd certainly stay with the theme that's already here and would encourage that. Thank you.
Anybody else? Okay, so I guess you have the direction you were looking for, sir.
Yes, sir.
Okay. Well, that's all the items we have on agenda. So, being any more business before council?
We will have a budget meeting on Thursday night at 7.
7 p.m.
Yes.
Exactly right, sir. And a CRA budget.
And a CRA meeting.
Very good.
7 o'clock is
Okay, motion to
Thursday.
adjourn?
Motion to
So moved.
adjourn.
Second?
Second.
All in favor? Aye. We are adjourned. Thank you very much.
This Thursday.
Same thing.
The final budget hearing.
Nothing after that.
It's up to you.
No, nothing else.
Nothing specifically scheduled yet.
I will not be here for the October 14th meeting.
Okay.
I can't. I had something scheduled for 7 months, and I can't get out of it.
Yeah. Okay.
That's our last regular meeting after the election.
That'll be a big one anyway.
Yeah.
Swearing in ceremony too.
That'll be the following Monday.
That'll be
Yeah, I have a,
following Monday.
Yeah.
I mean, traditionally, that's the week we do it.
oh, and that Monday I'll be out of town.
Well, swearing in ceremony.
We've got a party scheduled. We got a party scheduled for Bill that night.
Yes, I get